Yes. Now on the slide here you can identify which is a mosquito, which is the female uh, Anopheles mosquito. Anopheles mosquito. And here we are talking about the topic of malaria. The topic is the malaria here, and here we'll be seeing that malaria is a life-threatening blood disease which is caused by a parasite, that is Plasmodium, that is transmitted to humans by the bite of the female Anopheles mosquito. Malaria is preventable and treatable disease and is one of the major public health problems of our country. The causative agent is the parasite, which is known to be the Plasmodium species, which is a protozoal parasite. So whenever if you want to know the causative agent, it is obviously the Plasmodium species, which is responsible for causing this malaria disease. Now we will see and we will understand the different species of Plasmodium that can cause malaria, which includes Plasmodium falciparum, which is one of the most lethal form of malaria, where sometimes it can cause the malignant malaria, which is a very dangerous form of malaria when compared to the rest of the malaria. Plasmodium vivax is not that much lethal. It can be easily be treatable. But what happens here, as I told in my slide, second slide, that vivax and ovale remain in dormant stage. They become inactive from days, months and years together. Later they can cause the fever-like symptoms in the patient. Lastly, there are two types of Plasmodium species. One is malariae and other one is the novel C. So these are the 1, 2, 3, 4, 5. These are the 5 different species of malaria which can cause malaria in the human beings as well as to the mosquito itself. Among these species, the Plasmodium falciparum and vivax are majorly a disease-causing organisms. And if I want to tell you, when compared to both, the falciparum is much more lethal in causing disease manifestation as well as in causing a very deep problem to the patient. It can cause malignant malaria, where sometimes the patient can die also if not taken prompt action or if he is not given treatment. Now here again I'll be telling you the different morphological features of malaria, and we'll understand the different morphological features within a short span of time. This structure, which resembles the Plasmodium species, that is vivax, and the most common species that causes infections in humans, and so popular that even George Washington and Abraham Lincoln were infected with Plasmodium species of vivax type of malaria. I am Plasmodium malariae and I cause infections around the world. I am pretty benign compared to others. So the benign form of malaria, which is restricted to a particular location, so it is not that much serious or dangerous when compared to the falciparum form of malaria. I am ovale. The shape itself is ovale. I am pretty rare and less severe than my fellow species. I guess you could say I am the nice one out of the 4. And lastly, we'll be seeing the banana shape. It may look funny, but it is one of the most lethal out of all the four different species of malaria. And novel C is not here, but novel C, the transmission is very common in case of mosquitoes, but transmission nowadays recent studies have shown that transmission to the humans cannot be ignored. So it can transmit even to the human beings also. Yesterday I have told you in detail about the transmission cycle. Again, I will not tell you the same cycle again. This cycle which represents the cycle which happens in gametocyte phase, where the male and female fusion will take place. This is sexual reproduction cycle. The plasmodium gametocytes will take place. It's the gametocytes, and it infects to the mosquito. Thereby, first person will be infected with malaria. Thereby, it mainly travels through the blood, and thereby it goes to the liver. It replicates over there, and many damage of the hepatocytes will be seen. The liver will be infected with malaria. There's a there's a bacteria. The plasmodium burden will be there in the liver. Whole liver will be infected, and the migration of the sporozoites, or migration transforming the sporozoites into merozoites. Then from sporozoites it transforms into merozoites, and some schizozoites will be there. It infects the red blood cells, yesterday as I was telling you, and each and every RBCs will be infected, and it causes the second infection in the mosquito, and thereby it causes infection in other person. Now we'll be understanding the hallmarks of signs and symptoms. The signs and symptoms. Before that, I would like to tell about the epidemiology. According to WHO, in 2015, 95 countries and territories had ongoing malaria transmission. About 3.2 billion people, almost half of the world's population, are at the risk of getting malaria. No doubt about it, malaria is preventable and curable, and increased efforts are dramatically reducing the malaria burden in many places. Now, we will understand the signs and symptoms now. The signs and symptoms can be observed within 8 to 25 days after the infection. Initially, we can see the non-specific symptoms will be developed, that is flu, malaise will be there, fever will be there, and it can progress to high-grade fever, headache, one of the most classical signs, hallmark signs of the malaria, body pains, nausea and vomiting may be experienced by the patients. The other non-specific symptoms, which include hemolytic anemia. Hemolytic anemia is very common, and it causes hemolysis of the red blood cells, the breakdown of red blood cells. Now, jaundice, hemoglobin urea, retinal damage, and sometimes it can cause the convulsions. These are called to be as non-specific symptoms. The classical symptoms include cyclical occurrence of sudden cold, fever, severe sweating, and shivering. During infection with vivax and ovale, the cyclical responses are seen every 2 days. It is called as tertian fever. Infection due to falciparum is dangerous, as the cyclical responses are seen for every 36 to 48 hours with fever. Sometimes the organism enters the cerebral region, causing cerebral malaria, which is again the life-threatening complications. The neurological symptoms are seen in these patients, which include abnormal posturing, nystagmus, seizures, and coma, because it invades the cerebral region. Various complications due to classical symptoms of malaria, like respiratory distress, metabolic acidosis will be there, change in the pH, imbalance in the pH, pulmonary edema is noted, pneumonia, anemia, cerebral malaria leading to the splenomegaly. That is nothing but enlargement of spleen, hepatomegaly, enlargement of liver, and hypoglycemia will be observed in later complication stages. Yesterday I told you about the life cycle of malaria. This is a brief description of about life cycle of malaria. Please be with me. The life cycle of malaria, that is the Plasmodium species, starts with the sporozoite stage. As we all know that when the mosquito bites a healthy person, the sporozoites present in the saliva of mosquito, firstly it enters into the bloodstream and then it invades, it goes to the liver now. In the liver cells, that is hepatocells, the sporozoites multiply asexually, as I was telling you yesterday, developing further into from sporozoites to merozoites now. The merozoites rupture the liver cells. You can see the merozoites, it ruptures the liver cells and thereby it makes an entry into the bloodstream, that is systemic circulation again. In the RBC, the merozoites are transformed into tropozoites and schizozymes and mature into merozoites again. These merozoites enter the liver or attack the adjacent RBCs, wherein some merozoites are transformed into sexual forms, which is one of the characteristic property of this malaria. The cyclic process that occurs in liver is known as exoerythrocytic cycle, and that occurs in RBC is known as erythrocytic cycle. Exo means it is not happening in the RBC. Exo, which is not happening in the RBC, it's happening only in the liver. Whereas that occurs in RBC is known as erythrocytic cycle. Erythrocytes is nothing but RBC. When a mosquito bites the infected person, the sexual forms enters the mosquito. As this life cycle continues, the classical symptoms like flu, cold, fever, and shivering may appear frequently. Yesterday I have shown you the presence of the classical signs and symptoms will appear after 2 to 3 days, when the merozoites around 100 to thousands will be released into the bloodstream. In the next part, we'll be studying about the pathology of the malaria. Thank you.